Hey Cam followers, I am a little bit too excited tonight, so I do apologise if I behave really badly. But I would love you to meet Laurie Edge-Hughes, who is one of my absolute heroines. She's from Canada. The picture's a little bit pixelated. We might have a little bit
of mine.
There's a long distance between us, so the picture might be a little bit broken. Sometimes the noise, the sound might break up a little bit, but bear with us because this is going to be amazing. Laurie, please introduce yourself to the Cam followers because they need to know you.
Okay, I am Laurie Edge-Hughes. I am a physical therapist, physiotherapist. I am based out of Calgary, Alberta, Canada. So we're like on the west side near the mountains. Let's see. So I have been a physiotherapist for 27 years now and have been essentially working with animals for 28 years. I know I treated a horse on the ranch in my third year of physio school because nobody told me I shouldn't. So I grew up on a ranch, right? And the product of a veterinarian and a nurse. So I knew I was going to go into healthcare, but I didn't want to memorize drugs or chop anything open or care about all the innards. Yeah. So fate would have it, I twisted my ankle and had to go for physiotherapy myself. And that's when I realized this is the stuff I like. It's the outside bits and you can touch them. And so I basically went into physiotherapy in university and came out, and I think about 6 months after that, took on a job at a clinic that's just near my hometown. And the lady there had trained in Scotland, and she had been doing horses. Yeah. So she was treating horses. So she got everything started with the Canadian Horse and Animal Physical Therapists Association. So I basically got started right from the grassroots in there, was secretary of the association. Let's see, in 1999, I ended up, because our membership was saying, how come there's no courses on dogs? They were all on horses. So I basically devised a curriculum and taught the first course in canine physiotherapy in Canada.
When was that?
1999. 1990. So 99, 99 was the first year in Canada and the United States. So I did both that year. And then 2001, I taught the first canine physiotherapy course in Australia. So, from there,
you're quite a pioneer, and that's why I'm a bit giddy about this because I've been.
I've got the glasses on and the gray hair.
No. I want to know what moisturizer you use because I've got bad laughter lines and you haven't got them. I have to do this now.
It's not moisturizer. It's lack of sunshine in the winter. So
yes,
that's all.
I might benefit from Scotland.
Cold air and no sunshine. Yes.
Okay, so Laurie runs something called fourleg.com. And we're going to come back to that later because I would like you guys to know about it. It's been an absolute godsend to me in my journey. And I think there's many therapists that now follow Cam that will certainly benefit from the work that you've been doing online. But we'll come back to that later. We're going to dive straight into it. And we've really struggled to try and work out what gifts we wanted to give you tonight because talking to Laurie, there is so much she can talk about. But we decided something that doesn't get touched upon very often is the spine. So we're going to start at the spine. And I'm going to get Laurie to just kind of talk through her thoughts about, arthritis of the spine, what sort of things that we can do for that. And then probably lead into a bit of lumbosacral, which I know a lot of you guys have got problems with their dog. And then we're potentially going to head into laser a little bit because it's a very controversial topic over here in the UK. It's great to get somebody from Canada that can't get hate mail to actually talk about laser. So let's start with the spine. Tell us your thoughts about, arthritis of the spine. Just start blurbing.
Sure. Sorry. I brought my friend. There we go. So I think arthritis of the spine is far more common than likely gets recognized in traditional veterinary medicine. So, I mean, in traditional veterinary medicine, we would recognize that you can have a degeneration of the disc, right? So that can get narrow. But then what you have, gotta find my good guy here. Well, there's one that's colored. Oh, there we are. But then what can happen here is these joints in between, right? So they go in like this, and those joints, so there's like two on between each vertebrae, and those are arthritis too. So you can have back pain that isn't from a disc, but from the joints. And so if I get a little bit technical and nerdy here, so normally, if this is all lined up the way it should be, it has a little bit of a roundedness, and so those they're called facet joints, right? So the facet joints just basically sit side by side, especially in the lumbar spine. What can happen is if, let's say, it can be too much weight, which I had read on one of the, what was it, what do you call those, where they're made and they've got pictures and they have a word for them?
Infographic.
I saw on one of your infographics where it was talking about the majority of arthritic dogs are overweight, right? So this can be a component of that as well. That oh, where's my blue guy? You can kind of see him poking out here. Okay. So then what can happen is this starts to go into more extension, right? And then with that, you start to get a bashing of those facet joints. So they start.
Why you get the extension, because you get the weight of the belly. So the back starts.
The weight of the belly, and or it's just lack of fitness.
Yes.
Right? So lack of fitness. So it doesn't have to necessarily be overweight. It can be lack of fitness. And all of that pushes downwards. Okay. And there are some thought process too. Well, okay, that's my thoughts. That also, if you have the very energetic dogs in their youth and they're like, if they crash and bash and they're like whipping around and whatnot, they can still do damage to the facet joints in through there. And then it becomes this kind of, I guess, circular thing where the joints don't move properly. They become degenerated in through there, which affects the disc. And then the disc becomes degenerated. When the disc starts to degenerate, it allows for more mobility, more motion in through there, or rather less stability. So then you further damage the facet joints on top, and you kind of have this cycle.
Spiral. Yeah.
Yeah.
And I think we've had a question here already. Is that known as spondylosis, which is what everybody latches onto? It's different. Explain the difference.
Well, actually, yay, because then I can get on my next tangent, which is so, okay, let's look at this guy who's, can you see the orange? Oh, hang on. There. So you can see the blue. Can you? Kind of? Oh,
Just about.
You can see the blue a little bit, right?
Yeah.
That's where the facet joint should be.
Yeah.
The orange part ends up being underneath it.
Yeah.
So if we have the bashing of the facet joints, then the body starts creating what's called facet joint extensions. So in the lumbar spine, the facets would sit like this, and they would sit beside each other here. With all that additional extension, we start to create a facet joint underneath, right? And behind. So now we almost end up with a ball and socket joint.
Ooh.
So here's my theory, but I like it, so it must be right. Okay, so if we have that, then nothing is now stabilizing. You don't have the bony mechanisms to stabilize the spine anymore, right? So I believe that these facet joint extensions are a precursor to spondylosis.
Right.
So spondylosis now is the undersurface developed bridges,
Yeah.
right? And I believe that the bridges are formed in a response to try and stabilize the mess that has happened up here with excessive motion or basically those facet joint extensions. So in my head, the earlier we can work on basically fitness of the dog, then you prevent that, and or look at ways that you can start to treat up here in the spine, so that we minimize the damage and maybe we can prevent the spondylosis. But
this is really interesting. So I'm going to be really controversial because before I started my journey, 2015, of getting completely obsessed about arthritis, I was definitely taught, and I read in countless textbooks, that spondylosis is its own entity. They didn't really go into great detail about it being associated with disc degeneration, and quite often it was an incidental finding. As soon as it bridged, it became non-painful. But as it tried to bridge, in their final moments, you would get some pinching. Whereas now, further on in my journey, I'm like, that can't be true. Because as soon as you get dysfunction, as soon as you get any kind of inflammatory change, there's going to be discomfort and dysfunction, and it's going to have an impact on surrounding structures. But I do believe that a lot of people still feel that spondylosis is an entity on its own and it's not really a problem. How do you feel about that? I know that's a lie.
which
I know it's a bit of a lie. I'm up to say what I hope you're going to say.
Okay, so if you develop that bony bridging and there's good disc space, then you shouldn't be pinching. It won't pinch nerves. So it is then in that essence almost incidental. Doesn't matter, right? However, I would agree that as it is bridging, that there can be pain with it. But I think too, some of that pain is likely coming from the facet joint that is the precursor to the spondylosis.
Yeah.
And then the next part of that is if this guy bridges, right? He won't move. He's not doing his job anymore, right? So the guy next to him has to do extra work.
Yeah.
And that's going to predispose him to degenerating at the disc and degenerating at the facet joints.
Yes. Yes.
So it's basically, it carries on. It's almost cyclical in how it will
And
affect.
The thing for vets is very difficult because if I look at an X-ray, it's a 2D picture. So most people in the UK and globally would have access to radiography. We're having more practices that do have CT. However, when I look at an X-ray, the facet joints are actually very hard to visualize, to look for sclerosis, because you've got layers and layers of bone on that 2D picture. So it's quite hard to identify that. So I would suggest that this is something that you're going to pick up manually and observationally. Is that fair to say?
Absolutely. Absolutely. Yes! So it's well, and even if you can see the joint, right? So let's say it's a shoulder and you can visualize it. What we know on human medicine is that your physiotherapy assessment will identify early arthritis before radiographic changes are even seen, because you get changes in the joint capsule, right? So I think this is part of, we need to be able to see and feel, and what does this feel, and does it feel normal, and is it uncomfortable when I do this, and understanding the whole anatomy of the spine.
Yeah. Yeah, and I think it is something that, I'll be really honest, I don't feel that, I still don't understand. I've got a long journey of learning myself, but I know that I didn't get taught it very well at university, and we very glossed over this area, and I think it's an area that continues to be neglected. Let's just rewind we have lots of requests about how to prevent degenerative joint disease and things that we could do to make sure that our dogs remain as healthy as possible for themselves. And as soon as you said about core stability and support and appropriate function around these, you know, the lumbar spine, for example, I remember being in India and I saw this dog, and it was a young retriever and it had no core. So its back was just a sinking swing bridge and it was really overweight. And I was like, oh my God, you are doomed. What kind of things could owners do to protect their dog's back? So say we've got a 1-year-old Labrador. If you could just give people any kind of things to think about to prevent conditions like this, what would it be?
Okay, I'm going to give you two. So really, I think that what's most important is to keep things functional, right? Because you can buy all sorts of toys and whatnot, but is it functional, right? So even something like walking up and down hills, right? That changes how the animal uses its body and engages the abdominal muscles for going up and down is going to be beneficial. And then the second one, my most favorite simple exercise is basically a plank, where you would get, say I got to figure out where my hands are on the screen. You would get a block here and a block here, which North American, I'm going to call these cinder blocks, but then I've learned for you guys, I'll call them breeze blocks. Which?
In Scotland, they'd just be logs. Or
logs, okay. Logs, chunks of concrete, whatever, or like two Rubbermaid stools, or basically your stairs and a second Rubbermaid stool.
Yeah.
And then start working with the dog. So the front feet are on one. Oh, wait, my dog has to be smaller than this. My front feet are on one, and the rear feet are on the others. And then you can slide that out so it's a little bit further, and they have to use their core. Because that's fun for a dog.
Yeah.
Can you hear my phone ringing? This was the best, but now the phone is ringing.
Oh, no. Is it urgent? Nah, it's not as urgent as talking to us.
I'm not even looking.
Nah, good.
It's the home line.
As a vet, I would suggest also weight control is
sure, absolutely.
Yeah, and we have a big problem, guys. That weight is a massive impact on things like this. So the best thing we can do as a nation of dog lovers is keep our dogs trim and exercise them. You know, we need to be taking our dogs out and doing appropriate exercise. So bear that in mind. So the kind of take home from this little bit section, spondylosis is only one bit of a bigger picture. And, you know, palpation and physio skills and observational skills and looking at posture really is worth its weight in gold. And you can get arthritis of the spine. Would you like to add to that?
Yeah.
No?
Well, I just had a fun thought with the exercise.
Yes.
Right? And okay. And when I was teaching in Sweden last, it was kind of funny because, and Sweden is like the epitome of fitness and health people, right? They're all fit in Sweden. And they have come up with a new thing that is like once every hour you need to move. And if you are in a lecture hall and some bell goes off, for 1 minute, everybody does sit to stand, sit to stand, sit to stand, or marching or something like that. Because even in Sweden, they think they should get fitter, which I find funny. But the point is, if you were to do like 1 minute every hour, right, then in your waking days, you might get 16 minutes of exercise.
Yeah.
So it doesn't have to be go to the park for an hour. It could be this 10-minute jaunt and that 10-minute jaunt. and another 10-minute jaunt, which is better for the dogs with arthritis anyways.
Yes. Yeah, we got a question. Does just going up and down the stairs help? I know.
Absolutely.
If the dog is capable and it's not dangerous.
Fair enough. Yes.
I'm absolutely sick and tired of seeing Facebook videos of dogs that have obvious disabilities and obvious postural adaptations and obvious physical changes, and you see people thinking it's hilarious trying to these poorly dogs do things that are just not possible. Somebody sent me a video earlier that broke my heart. 3 Daxies running around a slippery kitchen floor, and I was just like,
oh.
Yeah, so yes, they can do, but just make sure that your dog is actually physically capable and balanced to do so. So stairs are good in the right hands. So spondylosis is the body trying to prevent spinal extension. Would you say it's that simple?
I think it's the body trying to stabilize a hypermobile joint. That's where I have come to believe it is. You won't find research on that, but because nobody else is talking about it, this has been stewing in my mind for a long time. So this is what I believe.
Okay. Let's move on down the spine and go to somewhere that I'm really, really passionate about, the lumbosacral. I think it's hugely underdiagnosed. I think we vets have a duty of care to be picking up on this disease a lot earlier. And I didn't know what I know now for at least 11 years of my vet career, and I probably missed it 10 times a week. So sorry, guys. But lumbosacral is a nasty disease. It's nasty. Tell us about that.
Yeah. So your lumbosacral disease is here at the very end where your L7, which is your last vertebrae, and he joins up, I've decided to say he, joins up with the sacrum.
She.
I know, well, the sacrum should be a she.
Should be a she.
There we go. She's more prominent and she seems really intelligent to me. So, what can happen in here is you can get degeneration of this disc space, right? And again, it all kind of fits in because you have motion in here, you have a change, and I don't know that you'll be able to see it here, but the facet joints change angle.
Yeah.
So L6, 7, the facet joints are shaped like this.
Yeah.
And L7, S1, they're shaped like that. So there we go, more symmetric. So they're shaped like that. So it goes from a joint that does this. This is all it's allowed to do because this is what the facet joints are shaped to allow. And then once we go to a shape like this, well, then it's got a whole pile more dance moves that can happen, right? And so it makes that L7, S1 imperfect biomechanics. It's a transition which sets it up for more movement, more damage to happen to the disc, more damage that can happen to the facet joints in through here. Anytime you start to get them, things are bashing and crashing. And again, the body wants to try and stabilize so you can get bony growth either underneath or sometimes you get the bony growth that's going to encroach on the nerve roots.
Yeah.
And I think that's why
to catch up. So when you look at a dog, you've got your rib cage, which is quite a fixed part of the spine, and then you go behind the rib cage and you hit what's called the lumbar spine, which is a lot more movement, and that allows the dog to bring their legs underneath them to be able to gallop and to propel and to push themselves. There's a lot of mobility in that part of the spine, which you don't have in the rib cage. And at the final part of that spine, where the pelvis is, so just in front of their back legs, that mobility kind of changes, and you get a point where the spine and the pelvis kind of start being closely associated. And it has a tendency to not have great stability in that region, and poor stability causes movement, and it causes inappropriate movement, which can cause inflammation, which can cause arthritis. So it's an area that we see a lot of problems, but dogs are amazingly, well, they're just copers. They're just beautiful, and they just adapt their, don't they? They just tuck up a little bit, tilt their pelvis, the tail comes down, just a little bit like they've got a dirty nappy, don't they? They kind of waddle a bit, and you know, they stay on with life. And then if a ball turns up, or a pigeon, or a squirrel, they forget the pain and they go for it. They bolt, and the owner goes, "There's nothing wrong. Nah, you wouldn't do that if it hurt." But then, when all of the excitement goes, they go back to walking like they've got a dirty nappy. Would that be fair to say?
Absolutely. And if you understand what's going on, right, in extension or even straight, they can pinch those nerve roots. So the nerve is going to come out right here. Okay. Yeah. So by putting themselves into flexion, they open up the space. And so that's where you're right. They will go into this rounded bottom, almost tucked under them. And it's all to open up the space so the nerves don't get pinched in there. The other thing that I think people should look for or be aware of is if they see on the paws any evidence of doing, okay, or those granulomas where there's skin changes in through there. But I had one client that the owner said, well, she's really weird. She'll suck on her entire foot and would put the entire foot in her mouth, and it was all lumbosacral when she was getting that little bit of pinch of the nerves, right? So if you get a little pinch of your nerves, you can get kind of a pins and needles, right? So if you think where you sat, right, you start off with pins and needles, and then it can get numb, and I think if a dog has pins and needles, what's it going to do, right?
Yeah,
you know, lick and chew at that. So,
yeah.
So looking for that, looking for evidence that the dog is licking and chewing as well might be a sign that it's there.
And learn my lesson, okay? So I'm saying this with absolute confession. I didn't pick up on it on my dog. So I had a border collie, she's a beautiful, beautiful dog, who made it to 15 and a half. And I really didn't pick up on the lumbosacral signs because I didn't know. I just didn't know. I love this dog to bits. And she still went paddleboarding with me. She still, you know, just ran with me. We did circuits together. We went everywhere together. Now, quite interestingly, when it was actually diagnosed, it was well formed. The spondylitic bridge was there, and there's a lot of sclerotic change on the bone. And I was like, that's been there for years and years. And she had probably once a month, kind of been out running, and she would just pop up lame, 2 or 3 seconds, and then it would go. And I'd go and rub her foot, I'd check for a little thorn, I'd see if she'd split a nail, I'd test her cruciate. I would do it, she's like, what is it? And because I didn't know how to test for lumbosacral disease, so it just didn't occur to me. But what was quite interesting, and it's going to lead me on to priming you, is we did a lot of paddleboarding. Now, Jennifer Aniston used to do paddleboarding for core stability. Now, my dog would paddleboard with me 5 times a week, and we'd go out for like an hour at a time. Now, think about that. On a paddleboard, on the water, moving all the way to balancing. She's basically on a physiotherapy kind of wobble board. And I wonder whether that stabilized her core enough for it to keep it under control, if that makes any sense. What do you think of that?
Well, quite, it could be. Because the other component with the spondylosis is if you can get it, well, I guess, to form before there's so much degeneration of the disc that you end up with permanent pinching on the nerve roots. Yeah.
So, yeah, absolutely. It's quite a broad disease. You can catch it. Like I saw a dog today that was 1.5. And it's not improving with managing the shoulder tendinopathies that it's got. And we're like, right, why is it not improving? there's something going on in the back end. This dog is weight shifting forward. It must be, because you should be getting better by now. So the back and a little bit of pressure, lumbosacral, and now you're like, right, okay. And then we put her on stance analyzer, because we're quite lucky here, and we could see that there was the weight shift, and we're like, So for any of the therapists or vets following, can you run through how you would test for lumbosacral as a little gift?
Okay. I was going to say, I have a whole, like, I have some advanced stuff that I do in my advanced spine courses, but
Yes.
even if just basic, right, to understand that, you know, pressure on L7 and pressure downwards is a big, you might find it that way. I like to find the side of the spinous process and push the spinous process at the side. And then if you kind of see what's happening there, if I push it one direction, you kind of see, if I push it one direction, you compress the joint on one side. And if I push the other direction, I compress the joint on the other side. This guy's a little too tightly wound. But you can come up with techniques where you actually try and compress the joints, create a bit of a pinch or a squeeze, and just for a short term, active that it's hurt, within the subsequent goal to do everything else to make it not hurt.
Yeah, you need to kind of, we need to kind of diagnose it to then do something about it. We will put links to all of Laurie's courses that we have hinted upon at the end. So if anybody goes, I must do, then we'll put links for you there. So what's for the public who are going, well, I would never know how to touch my dog there, and I would never dream to do so. I would never want to hurt my dog. For me to help you, if your dog has got a very big curve to their lower back and they're developing quite a bottom, their tail tends to be down more than it is up. If they tend to have a waddle, you know, if they're just guarding that area, quite often dogs like that area being rubbed. They love you scratching in there, don't they?
And sometimes they are multi-poopers. In that they can't do their business in one go.
Yeah.
They have to do a little squat. It's like if your back hurts and you bend forward, you're like, oh, whoa. So when they get into that, you know, hunched maneuver and their Valsalva, right? They're to try and push the poop out. That can be painful. So sometimes those dogs are walking poopers, or it takes them 3 or 4 tries to finish their business.
Yeah, we call that the poo-poo train.
Oh, okay.
To deal with the carriages of poo.
Yes.
So,
and I also think that you can have the dogs. Then I had one. I did a blog called Poopy Butt, Dingleberries, and what? Anyways, but it was all about, right, this owner that had noticed that her dog was getting more. She called them Dingleberries, hanger-oners in the back fur, and we found we found with him it was lumbosacral pain, and we fixed that, and he could poop better.
Yeah. We call them bum nuggets. Have you heard of bum nuggets?
Oh, that's with your accent, that sounds lovely.
And another thing that you might find is they start getting anal gland impactions. So because of that,
I'm sure.
Yeah, they don't naturally empty their anal glands when they defecate. So if you've got an older dog, well, to be honest, any age dog, to be fair, and you start going, well, you've got anal gland, reasons before, is it worth just stepping back, guys, and look at your dog's posture? Don't immediately assume that they've got an anal gland impaction because of an infection or because of an allergy. Just do me a favor, step back, have a look, and if your dog's got quite an adapted posture, just bear that in mind. We've got clag nuts. We had a clag nuts.
I'm just looking and like, oh no, now people are coming up with their own terrible phrases.
By the end of this evening, guys, anybody that comes up with the best terminology for bits of feces hanging off the back fur of your anus, then you're a winner. Right, moving firmly on. And the reason that I wanted to talk about lumbosacral disease, it was close to my heart. Please don't make the same mistakes that I did. Is that pain control can be quite different in that area. And having them on a standard non-steroidal alone may not be enough. So I really want people to open their minds that there are many ways to control neuropathic pain. And please talk to your vet about it. So it might be a change in the drugs that you use. It might be a combination of drugs. It might be that you add a modality as well as home therapy, exercise, which leads me nicely onto a topic that I'm just going to let you go with, because laser's big in the UK now. You know, a lot of practices are now offering laser therapy. Quite often the clinics are run by nurses, maybe vets are leading, nurses are managing. A lot of physios have lasers. The class 3B, 4 debate still rages. And now there's a lot of class 4 laser providers. And there is still, you know, we need more evidence. We do need more evidence in canine work. But where are you with it? And tell us about, you know, what your thoughts are on it, what you use, etc.
Yeah, laser has to be one of my favorite toys, my favorite tools, right? I think it can be brilliant when used appropriately.
Yes.
So that becomes the crux of it all. It has been shown it can be great for reducing pain through a lot of the same pathways that medications work. From a joint perspective, right, extremity joint perspective, it can help with cartilage regeneration. Mm-hmm. It will help pain also from the perspective of the effect it has on the nerves. Mm-hmm. It can help pain by even just the stimulus creates an influx of blood flow, and that can help flush away the products of inflammation and bring in oxygen, nutrients, and all the happy things into there. Now, I think it sometimes gets a bad rap, or people say, oh, no, I tried that, it doesn't work for me. Because you have to point it at the right area. So the person shooting the laser needs to have some sort of background in knowing, you know, in doing the assessment to know exactly where it needs to be pointed. Mm-hmm. And you need to have an appropriate dose based on the machine that you've got. So one of the things that I have found with laser is you can be giving way higher doses, especially with the class 3Bs. We can get way higher doses, but you need to be able to point it at the joint line. You need to know that if you're doing it for the, let's say, the hip, you can't do a good job of getting into the hip, but you can do a good job of targeting the deep gluteal. Yes. For the stifle, you want to be able to get into the joint. Shoulders is one where, like I said, this drives me crazy because I think it gets promoted as a magic wand, right? So I have the love-hate. One, I absolutely love it. I use it on just about every patient that comes through the door. But my hate is that untrained people are using it, untrained facilities are using it, and they're using it like it's a magic wand, and they're not incorporating it with anything else. They're not pointing it at the right structure. They're not dosing it high enough. So there's a lot of factors that come in that it's not just about get the laser and all your troubles go away.
I think I totally agree with that. In that, you know, we use it a lot where I'm working, but it is always preceded with a very accurate diagnosis to the best of our ability. And it might mean that we're not actually treating the primary, we're treating the secondary. So if we've got a dog that has a lumbosacral, I might be using it more for the iliopsoas than I would actually be targeting the lumbosacral, because that's where I feel the dog's majority of discomfort at that time was. And I think it's a brilliant tool. As you said, I think that people need to have the background understanding of what tissues they're working on and why, and also giving people understanding of the input required and combining it with appropriate exercise.
Anything else?
Yes.
Yeah, because it's not sorry, as you said, combining it with everything else.
Yes, and that's something I think
we have our time delay now.
Well, I think every therapist that watches this page can relate to this. You know, we were talking earlier before we went live. There's nothing more heartbreaking if you have just spent an hour massaging a dog, or you've just done a really thorough, thought-out laser session, or you've just dry kneed the dog's back, or you've just done a hydro session. And then the owner allows the dog to jump in out of the car. You know that they haven't stopped it chasing the pigeons down the garden, and it's still jumping at the postman and anybody that walks past that window. And you sit going, yeah, that's a waste of 50 quid. Do you think I'm a bit blunt saying that, or do you feel the same?
Well, no, I think you're right. But it ties in with absolutely anything and everything that is rehabilitation, right? So it's not just the laser, but it's, I had one and the owner was like, you know what? He walked out of here great, but, he's been sore ever since. And I thought, yeah, so I retraced your steps. What happened? Well, after we left you, we went to the dog park and he jumped out of the back of the truck before I could help him down, and he's been sore ever since. And for him, it was all in his upper back. The things I normally treat on him weren't any worse, but he had new problems because, anyways. So yes, I do believe there is a period of integration for whatever therapy you provided that day, that the dog has to kind of take that in, right?
Yeah, and that's really interesting. When I did my my therapy, my massage course, the opportunity to get it. So if you're going to have a massage as a human, they say, right, put your phone away, go and drink some water, and rest for the rest of the day. And all of us go, get the mobile, go collect the kids, and watch Tesco's, and we completely undo all of that benefit. Whereas I have seen dogs, they don't have mobile phones, by the way, so they're quite good at going. So it is within our capability to allow them to have that benefit. It's us that then allow them to go and do things that they should be allowing the tissue to have a chance to take benefit of the intervention. There you go, rant over.
All good.
Yeah, I'm glad that the world knows that dogs don't have mobile phones now as well. So good, I feel my job is done. So moving on. So we've done a little bit about laser, and I'm glad that you've got your opinion out there. What other tools would you recommend people look into? So say I was a nurse and I had got an interest in OA, so I was interested in arthritis, and I was in a clinic based somewhere in Norfolk, which is a part of the UK. I don't know if you know about Norfolk. Terrible roads, by the way. So I have a clinic, and my boss has allowed me to purchase something to support me in my OA clinic. What kind of things would you use?
Okay, well, my first thing, because I always was asked this, if you get to have purchasing power, you get the laser. I love my laser. Okay. And then after, let's see, my second favorite is now my Shockwave. I really like my Shockwave. And I have it's a radial shockwave. So there's difference between focused shockwave and radial shockwave. And the radial shockwave, you know, the animal doesn't need to be sedated. It's kind of a different thing. But I am finding. Pardon?
We'll get you back to go through all that.
Okay. But I'm finding I quite like the laser and the shockwave. I think acupuncture is great, or being able to stimulate the acupoints.
Over here, only vets are allowed to do acupuncture. Right. Yeah. So.
Pulsed electromagnetic field.
See, this is what I was hoping you were going to talk about, because we're doing the Hills OA Roadshow this year, and we get to go around the UK. We're doing 12 events, me and Danny, and we get to lecture to anywhere between like 40 and 70 nurses at each event. And they often say to us, what do you think would be a wise thing? And we quite like PMF because it means that they can still talk to the owner while something's happening. So they can be enjoying themselves, could put it, you know, that's happening, and now I'm going to educate a lifestyle, exercise, weight control. What do you think?
Basically, all of our treatments at my clinic, all of the treatments occur on one of those pulsed electromagnetic field blankets.
Wow.
So if you have to lie on the floor, you might as well turn the floor on.
Yeah, nice. I like that.
So I think it's very good. And I've had owners purchase them. So ones that they can put in their dog's crate or so that they can use that. And then like these little guys like this are little take-home units that there's a few different on the market. There's the Assisi loop. This one is a heel fast loop, which are, you know, something that they can use under supervision, because we don't want this to become chewed on. No. But it's something that an owner can utilize at home too.
Yeah. So, can you just very simply explain the difference between static magnets and the PMF? Because there's a lot of people hear magnet and they just like, oh, I'm just going to go and buy a $20 magnetic collar. Can you just in a very elevated speech?
So pulsed electromagnetic field is there's a magnetic field that is created by an electrical current running through the wires. So when we have this electrical current running through the wires, it creates a magnetic field at a 90-degree angle to the wire that's running through there. And what they have studied is there's that different hertz or different, you know, how fast the current is going through will create different pulses of the magnetic field that can be therapeutic. So I always joke, it's all the benefits of power line without any of the nasty side effects.
Oh, yeah. Please don't go and start putting your dog under power lines.
Power lines. No, that's too much. Yeah. Don't buy a house under the power line just for your dog. No. So they're a little different. There's been research on the pulsed electromagnetic field. There really isn't much research on static magnets. Yeah. And those that they are trying to, you know, promote as being therapeutic are a much higher, it's called Gauss, is the pull that the magnets create. So I had one client a million years ago when I was treating people that she's like, well, you know, I just strapped a fridge magnet onto my elbow and, you know, it doesn't feel any better. Anyways, so you will not feel better.
Like one of those letters, like an L on one side.
I don't know. It was somebody's business, right? That she, anyways. So if, like I said, I've not dove too much into it, but I know in trying to find research, I can find research for the pulsed electromagnetic field, but there's not the same body of evidence for just static magnets. So,
and I totally agree with you on that. We often seek the help of David Somerville, who is an extremely well-respected man in the field, who's done a lot of work on PMF. And yes, static magnets isn't where you want to go, guys. There isn't a huge wealth of evidence that it'll be anything more than placebo. So just be careful of that. What else? We wanted to go into something really, really kind of a little bit new way of thinking, didn't we? In that we wanted to go biopsychosocial.
Okay. So So biopsychosocial. We're gonna have this go on for 2 hours, you realize. So biopsychosocial is a way that on the human side, this is like the big aspect of pain management right now. So bio is the medications, the supplements, even the modalities. All of that affects the biology, right? So the cartilage, the blood flow, all of that. But then psychosocial is where human medicine is finding that is the game changer, is the psychosocial aspect. And how this, your brain can decide whether you feel the pain or not, right? So you can, and there's stories of guys in war and their leg gets blown off and they don't feel it. Yes. They don't feel it at all until they're, on the gurney or the hospital bed or something. And they're like, holy crap, when did my leg get blown off? Yeah. Your brain has the ability to modulate that.
Yeah.
So the psychology is something that we can tap into in people. It becomes much harder to tap into psychology in a dog. Mm. Let me. Yeah, that's good enough. Okay. So I'm like, which story shall I tell you? But anyway, but where I think what we can tap into the dog is a bit of the social aspect, right? So it becomes what you do with your dog. Don't just let them live in the house like a potato anymore. They need to go out, and even if it's just short bouts, right? If they can't do very much and you are driving them to the park, well, drive them to a different park. Drive them to a different part of the park. They need to get out. They need to, smell their surroundings. Even if it comes down to the point that you put them in a little red wagon and you take them to the park in the little red wagon so they can watch all the other dogs run around and have fun, right?
Yeah.
That is huge. There's also a thought process that even giving them something to do. So if that is like coming to see someone like you or me that does the rehabilitation, it's an outing and they're special.
Yeah.
And that is huge. So that's the component that you would otherwise call placebo. But who cares if it works, right? So they are special. They have a special outing. Mom or dad cares about them enough to take them out. They get to do something. They get to, be touched. That's important. And then it also ties in with, like, maybe you find somebody that's running a senior dog class or a senior's dog meet and greet, right? Where they can tootle around and meet each other, but not get jumped on by the 2-year-old or the dog that's crazy and way too energetic for the senior or arthritic dog.
I think it's good for the owner as well. So something that we're really passionate about at CAM is that we see that the dog and the owner as a unit. And I know when Holly was on the downhill slope, Lindsay will tell you I was terrible. But my negativity and my despair and my depression was having an impact on her. And we were bouncing like a horrible wave back between each other. And it just wasn't, it was a really fetid environment. And, getting out and doing stuff and meeting other people. And she used to wear her bandana, guys. That's a big plug for this little job. So she used to wear a bandana and we used to go out, and that gave people the warning. She was fragile. She's a little bit immobile. She's a bit nice, be careful. But it was really important. And I wish there'd been older dog groups, really, that I could have teamed up with, because I felt really lonely and, it was a really tough time. So I think psycho, let's take it away from the dog, biopsychosocial, the psycho is the owner in this big package that we're talking about.
Oh, totally.
So that's great, and I'm glad we've included that because I do feel that it's massively neglected. And one of the phrases that we use when we lecture is arthritis. Canine arthritis isn't just about the joint, it isn't just about the leg, it isn't about the body, it isn't just about the dog. It's about the dog-owner relationship, and it's emotionally, physically, and financially really debilitating. So let's look at the bigger picture. While I'm at it, I am going to do an absolutely horrendous plug for a few things that we've talked about. This is a little booklet that Cam does, and it's called Managing an Arthritic Dog in a Busy Household. So biopsychosocial will feature in this, gives you some tips and ideas about how to enrich your dog's life. We've also got this, which we've touched upon, about protecting them from harm. This is a really good little booklet about adaptations to do around the home and the home environment and the car to try and protect them from further harm. And there are actually 11 booklets now, so I'm going to be brief. But this is something else that I really think is something that I should look into. It means that people like Laurie, can talk to your vet. So if you're seeing a therapist and they're doing their biz and they're getting the shizzle and everything's going great, but they want to tell their findings to the vet, and the vet can look at their section and the therapist can look at their section and talk, and everybody's working as a team. That's that book, okay? So check them out, they're on the Cam Shop. And finally, a little plug. These guys, give them out, put them on car windscreens, give them to people pockets. These just show you where Cam is. So it's a really good thing for you out walking. You can go, hey guys, I've just seen, have you thought about, having a look at that website? And anti-tape. There you go. Jobs are done. Let's tell them about your massage course, because I'm really excited about this. Tell them about what you've been up to.
Okay, so I have produced an online canine massage course for owners. So I guess first off, it's not to say that, it replaces seeing a massage therapist or that it will certify you to do this in any way, shape, or form. No, but it just gives you, as a dog owner, guidelines of how you can massage your dog. So the research out there, there's tremendous benefits to massage, from the pain management, from the reduction of stress, from anxiety, from a lot of those psychosocial factors as well. But research shows that the benefits from massage only stay so long as you are getting regular massage. And so the one research article had said that, so basically, if you're getting regular massage that you stop after 4 weeks, those benefits are gone. So if you want to be able to continue those benefits and carry on, then that becomes something that you can do at home. So the course helps you, guide you through a little bit of the anatomy, the different massage techniques, how you should be massaging each sort of section of the body, and give you something that you can do as an in-between seeing whatever healthcare practitioner that you're seeing. So that's kind of why it was created, is to give people something at home.
Yeah, and I think that's really important. So we ended up putting it to the CAM ethics committee. So I just want to explain about CAM. There's the core four, and then we have the CAM team members, which have all housekeeping roles. So there's about 20 people in that group, but then we have the advisors, and then we have the facilitators. So it's quite a complicated arrangement of people. Amanda Thomas being one of our amazing helpers. Hi, Amanda. And Helen, who's there as well, another helper. We also have a little ethics committee. So I don't like the pressure of making decisions now, because we're too big and we have a lot of influence. We don't want to make bad decisions. So this went out to our ethics committee in the last couple of days, where we all kind of thought about it and thought, is this the right thing to do? Is this in the owner's best interest? And we have decided that we think it's a really good idea, because we've got followers now that are in New Zealand, Australia, Canada, America. We've got people that are actually not located in a region where they could access therapists. So for that reason, we feel that an intervention like this could be very beneficial. And as you say, some people financially struggle to see a therapist on a regular basis. So they might want to have an initial meeting with one, and they might say, I'm going to see you every, say, 2 or 3 months, but in the between, I'd like to be able to influence. And I regularly suggest to my owners to go and do the Garland myotherapy course, owner-based one, because I want them to do more when they're not seeing me, and they can't afford to see me or they can't get to me. So we're quite cool with this. And we hope that you guys are cool with it. We're not trying to steal anybody's jobs. You know, we're not trying to steal trade. It's not like that. It's an honest intention to try and give owners something that can help their dogs. So I hope you guys see it like that. And we'll put the details below. Laurie's been absolutely lovely about this, and you've got a massive discount because, you know, well, Laurie's new to CAM and she's wearing the t-shirt, by the way, guys. Check it out. She is wearing the t-shirt. That is available for all therapists and owners and vets to buy. There you go. So she's very kindly a big discount on the course, and she's also donating a small amount of money towards CAM for everyone that's sold. So I will put that below later this evening. Right, we're at an hour, and I don't want to burn you out because I want you to come back. So we're going to do 10 top tips, and then everybody that's this are going to say, isn't she bloody lovely? Because she is, and you're going to come back. And by the way, I do need to tell you that you've got Laurie Edge-Hughes, Girl Crush, Kelly Johnson's Hannah Cox, Kelly Johnson's I Love Laurie, she's fabulous. Oh, God, you're really popular. Your head's now going to get bigger and bigger, and it's going to expand beyond the screen. So
yeah, that's right. I won't get out of the room.
I know. Yeah, sorry. Yeah. You're going to be stuck there until it deflates back down.
Yeah, either that. I'll be one of those people that they have to break down the window and haul me out.
Yeah. Did you ever see that documentary? I've totally gone off the ring. There was a book about people that got really, really overweight because they had just kept feeding them to the point that they actually.
Well, I come from human medicine, so when I worked at the hospital, I saw those people. Yeah, they're like. Okay. Yeah. Anyways.
Not nice. But that, you know, biopsychosocial there, that's a biggie. Anyway,
off topic.
Off topic.
Okay. I was so stressed. Okay, so I quickly wrote these down, and it's not even on like a sheet of paper that's like, okay. So my number one.
Laurie actually didn't sleep last night because you got so stressed.
About this. I'm nervous to do this.
It's fine. Go for it.
All right. So number one, and you've said before, a lot of these overlap what other people say. Okay. So weight management. And so number one, it can be to decrease food. A lot of treats are really high in calories. So I've had owners say, well, where they've like allotted, this is the little jar. I'm only allowed to give them this in the jar for treats, or they only are allowed to have green apples or stuff like that. So watch out for your treats. Okay. Two. Move more often, right? Two. Move more often. And that kind of ties into, if I didn't tell you about the Swedes before, I was going to tell you about the Swedes here, right? If the Swedes have decided that they need to move more often, the rest of us are just a bunch of potatoes.
Yeah. Okay. The Swedes get it right. They really do get it right.
Yeah. Okay. Number three, short-term meds are okay. And if needed, long-term meds are okay, as long as, you know, they're fine with it, and obviously the vet supports it. But we had one dog that they so badly didn't want the dog on meds. And I think they had gone on a supplement. They were able to take the dog off of the medication. And then they're in a panic because they're like, but he's like, he needs the meds. And at that point in time, he was 15 years old. And I said, let him have the meds. What about his liver? Let him have the meds. So anyways, it's not the worst thing in the world. So it can so be an advantage, right?
Yeah.
Build the muscle while you got the pain management on board.
Yes, and we say this and we say this and we say this, and I'm so glad that you said that, because there's such a fear. There's such a fear about medicating, and I just know if we need pain relief, use it so that you can see it as a stepping stone to get somewhere else, or if it's at the point where everything else isn't working, use it. What we don't want is people that are using it, the dog's overweight, still jumping in and out of the Land Rover, and you're falling down the stairs.
Right.
Sorry.
Okay. 4, start supplementing ASAP. So anytime there has been any kind of a joint injury, any surgery to a joint, you put them on the supplements and you keep them on forever.
I think we're the evidence that is out there suggests that integrating them into your plan earlier is likely to be more beneficial than going, oh my God, we're arthritis, we're going to give them. So I totally agree with that.
Yeah.
If you've got a dog that's maybe
that's good
of abnormal forces through normal joints, or you've got a dog that's got abnormal joints because of dysplasia, if you want to go down the glucosamine and chondroitin and the avocados, soybean unsaponifiables and the type 2 collagen, you do it then. But please, when these dogs come in and they're in pain and they have got significant degenerative joint disease, which we see more often than not, relying on supplements then, nah, you need to be looking deeper than that. Go for it. Yeah, sorry.
Okay. 5, keep their toenails trimmed. Toenails. It affects how their whole body can position itself. So keep their toenails trimmed.
From a young age too. Isn't it sad when you see people that haven't been on top of it and the quick's grown all the way down? You're like, they're going to be hard to trim. Horrid.
Okay. 6, seek out the help from professionals that can either provide some therapy, but also give you specific home program. So whether that's how to do the range of motion, how to do some massage, how to do different joint therapies, right? So I always say, I will ask the owner, so what is going to work for you? And if they're like, well, you tell me, I'll come as much as I want, great. And then you have the ones where it's like, okay, well, this is hard for me. Can you give me stuff to do and I'll come back next month? Absolutely. I can do that too. But see someone that can give you specific things for your dog.
Yeah. And I think that's really trending. A lot of the people that are in the rehab circuit that are now lecturing globally have a very strong opinion that as a therapist, you really should leave people with stuff to do. So if you are a therapist listening to this and you go to people's homes and you do your thing, think about how you can make it last and give that person that gift, because you don't want it to last just a transient period of time. You want it to have impact, because this is about the quality of life of the dog. So just think about long-term. Nurses as well with your clinics. What are they going to do when they step outside the door? Leave impact. Sorry.
Where are we at now? 7. Figure out your dog's maintenance schedule. So figure out, so let's say if they're coming to see me, what I will say is, okay, let's say they're very arthritic, they're very painful, and the owner's willing to come, once a week for a month. And then we figure, and they're so much better. So then figure out what is the maintenance so that as long as it's affordable, right? That you can figure out, I can do good coming once a month. Or I can my dog will do well coming every 8 weeks. And then it might be, 8 weeks was too much. We have to go 6. But figure out that maintenance schedule, because that's going to be better than dipping in and out of pain flare-ups.
Yeah.
So
and don't be scared to ask your therapist. I think something that I see a lot on Holly's Army, which is the community group, which is lovely, people seem to get shy about these things, and because they can't ask the question of, look, I can't afford to do this weekly, what can we come to an arrangement with, they then just stop. because they're too embarrassed to say that. Don't be embarrassed to say anything. So I was seeing the lovely Willow, who is this amazing, amazing 8-month-old yellow Labrador with the worst hips ever, the worst elbows, 8 months old. And she's doing really well with the hydro. And we know at the moment weekly is good. We're happy with weekly. And but we're planning to go 2 weekly. We're going to start pushing 3 weekly and 4 weekly. And you know, that is the plan. But you need to be able to have the good conversation with your therapist to get that plan.
Yep. Good. 8 is keep taking your dog out, right? So this is the biopsychosocial aspect. Drive them to the park, go to different parks, take them out in a wagon if you need to, but take them out. Give them the mental stimulation.
Yes. And Holly's Army, you're amazing, wonderful people who keep promoting that. Go Canbusters. Awesome.
Okay. I came up with 10. 9 is learn some home therapies and use them.
Yeah.
Right. So figure out what can you be doing at home. Okay.
And the simplest would be heat therapy. Would you agree?
It can be, but with the dog's hair, heat is hard to get through the tissues, right? The hair is designed to insulate from heat or cold. Okay. So that's where I think, you know, some of the manual therapies, the massage, pulse electromagnetic field, coming up with different, like even range of motion might be better.
Okay, cool. Like it.
I like it better. Okay.
Yeah. No,
and 10. Okay. And this ends up being, I don't know, I'm likely preaching to the choir with this group, is appreciate the dog you have. Down to, actually, I put a blog post, I think it was last week on Foreleg, which is my practitioner's website. And the blog post was about appreciating, getting the owners to appreciate the dog they have, especially as they start to slow down, instead of going, oh, but he can't do this anymore and he can't do that anymore, but to appreciate, this is the dog I have and this is what he can do. So looking at what are the cans, he can do this and he can do that. And it's certainly more like as the dogs are older, that sometimes we see we have to coach the owner into that path of, it's okay if he's not running on the treadmill for 30 minutes. If he does 10 minutes, that's still okay. Anyways, like I said, this group is likely preaching.
No, and I had exactly that conversation at about 6 o'clock with my last client of the day, is that at some point that owner has to come to accept that their dog is not going to be able to do what it used to do without creating a flare afterwards. So we're talking your Cocker Spaniels that are in and out of bushes, over brick walls, in and out of ditches. The brain and the body just disconnect when they go out. And it goes out and it does the crazy stuff. And by the time it comes home, it can't even get on the sofa. It can't even get through the back door. You know, it is proper broken. When all of those neurons, like, I hurt. And it's very, very hard for owners to accept that, you know, that has got to stop because something else is going to start. And I think that's a wonderful top tip for people to, you know, accept what they've got now. Well done, that lady.
There we go.
Yeah. So we're going to end here because we've done 73 minutes and 14 seconds, which is awesome. I just want to leave you guys knowing that the lovely Laurie runs this amazing online platform called foreleg.com for any therapists or nurses or vets that think, how can I start learning more about, you know, this world, this rehabilitation? You know, this is interesting. I want to be able to tap into something in a convenient, little more little fashion. Do go and check out foreleg.com. Again, we will put a link below. It is fantastic as a really good introduction into a huge topic. And you've been working on it since, what was it, 2011?
2011. Yeah. It's got content on there that goes back then that many years.
Yeah.
And then the massage course. Thank you. The massage course is on my clinic website, so my clinic in Calgary, so that's where that one is, because then it's a little more owner focused in through there. Yeah.
Well, as soon as I get home and I pour myself a glass of wine, I'll start putting all the links on. Thank you so much. Everybody's already saying thank you. You've obviously really done well, because people think you're fab. And the more people that say she's fab, she will come back. So please say thank you. Laurie, you're amazing. I've had a whale of a time since 6:15 when we started talking, and I really hope to see you again. So thank you so much. Until next time.
Thank you for having me.
Not at all.
Good night. I have the rest of my day ahead of me, but good night to you.
Yeah, I'm gonna go drink wine. Bye bye.
I shouldn't drink this early.
No, you shouldn't do. See you later.
See ya.